Hello, everybody. It's very nice to have you all here. We just started this webinar. For your information, this session is going to be recorded. However, none of the attendees are going to be recorded or filmed, so no worries about that. In fact, it is a bit weird because, there is me, Renata, and Beata here, and we can only see each other. So it, it really looks like we're talking to each other, but we know you're here. So please make a good use of the chat whenever you want to have a say and interact with us. I will just start with a bit of welcome and introduction, and then we will share the agenda for today's meeting. So we see how we will spend these 90 minutes together. So this is our second webinar because we hosted the first introductory one last July. We had our scientific co-coordinators, Helen Cole and Margarita Triguero Mas, joining us and giving us a first overview of the project. For those of you who are not entirely familiar with our project, GreenMe is an Horizon Europe project that is going to last for 4 years. We started in September 2023 and we will finish in August 2027. The goal of this project is to scale up and address the importance of green care on different levels for mental well-being and equity. This project is very, very big. We have 20 different partners. We have multiple European countries involved, plus a partner that is based in the US, specifically from Portland in Oregon. We have different work packages. We have 50% of academic background and 50% of grassroots level organization. So it's very diverse. It's very dynamic also, and it might sound complicated. It's not, I would say. So today I'm here with Renata Giedych and Beata Gawryszewska. I hope this is a good pronunciation. Beata, forgive me. And there is also Olivier, my colleague, who is going to deal with everything behind the scene and making this flow smoothly. Today we're gonna focus on work package 2. Work package 2 is the first of the work packages of the GreenMe project that it has been fully completed. It has focused on assessing the status or the current status of green care in our study countries and in general, plus focusing on mapping green care actors, addressing their level of influence in shaping green care systems, what's working, what's not, identifying successful financial methods and models and role model organization. But Renata and Beata will speak thoroughly about this. They are the work package 2 co-leaders, let's say, and they are from the Warsaw University of Life Sciences. We will share now the agenda. So you will see what are we going to do today. So there was this little welcome and introduction. Then we're going to have a little of what we call an icebreaker. The idea here is not to lecture you. I know that most of you are here to learn and to see what we've been doing, but we believe that exchanging and like building together is what matters the most. So we want to get to know you. We will have 5 polls that we will launch during the webinar, and we invite you to share it. Don't worry, it's not like we're not asking you to write books or anything. It's very, very easy to grasp questions and easy to answer. But it's important for us to see, for example, who you are and how you ended up here. Then we will have the core of the session, which is the key insights from Work Package 2 with Renata and Beata. Then we can have a bit of a discussion. If you have questions, we will ask you, we will try to guide a bit this conversation. But again, feel free to drop your questions in the chat. Olivier and I will monitor them and try not to miss anything. And then we will have our closing remarks, see how we can look ahead, and we can move forward with what has been presented during this session. So if everything is clear, I hope so, because it was really the beginning. I hope I made myself clear. We can start with the first poll, and the first poll is about you. We want to know who you are, what we define in comms as getting to know the target audience, you know. So you can answer. It's mostly a single choice, and we can see if you belong to the academia, if you're a healthcare practitioner, a provider, if you already work in natural-based interventions, if you're a local or national authority, or if you're something else, a category that we missed, please feel free to specify it in the chat. We'd like to know. And then, you see, okay, because I didn't see the, okay, cool. So we have academia, we have some natural-based interventions professionals, healthcare practitioners, we have some others. Let's see, do we have it in the chat? The chat is here. Okay. Okay, that's student of a master. Okay, hi Teresa, student of a master's program on outdoor environments for health and well-being. That sounds super cool. Thank you for sharing. Okay, so Renata and Beata, they cannot see the results so far, but we will say what the percentage are. Then we have Joe Scott, artists, researchers working with a charity on a green mental health project. That's wonderful. And where is it based, Joe, this mental health project? We have a natural-based student from Stockholm University. Sounds great. Portugal, okay, but the UK, okay, so you're based in the UK. So we have some partners in the UK. We have the University of Kent, we have the University of Salford, we have some grassroots organization, like we have Social Farms and Gardens, we have Mind in Bexley. I'm a junior at Texas Tech University, majoring in human sciences. Oh, thank you, Pierre. That's amazing. Okay, so I would say that probably we all voted 34 out of 40. Okay, 85% of participants. That's very cool. Thank you. You're very responsive. Okay, Raul, finishing a PhD about how living nearby green spaces relate to the adult population in Norway. Wow, super cool. Someone from Belgium. Okay, hello, hi. We're based in the same country. Welcome. Julia, an NGO working on mental health and urban environment in Italy. Then we have Dr. Vera in Berlin and Sweden. Zala, landscape architect, super cool. Neuroscientist from Maria, designer from Canada, Spain. Wow, this is insane. Thank you so much for sharing. So far we can see that we have a sort of exequo, let's say, between academia and natural-based intervention professional. We have 41% of the latter and 35% of academia. We have some healthcare practitioners, like 6%. Still good. Healthcare providers, 3%. We have 3%, one person that is a local or national authority. We would love to hear from you. Who are you? And then we have the other people that shared in the chat. Thank you so much. We can move forward with this. we can share the result, I think. Yes, exactly. So you can see that is perfectly in line with what we were hoping for when we co-created this second webinar. Thank you so much for being here. Then we can move with the second poll. It's a bit different, but the idea is to see how familiar you are with the concept of green care, and the consortium has established back then a working group specifically dedicated to draft comprehensive and creamy definition of green care. So we would like to see whether this resonates with you, if you're familiar with it, and you have the definition. Green care is defined within the GREEME framework as a way of conceptualizing different ways of engaging with nature that can improve human health and well-being. It is framed within a 3-level model, from nature in everyday life to nature-based health promotion to nature-based therapy. So are you familiar with the concept of green care in this form? And is it green care in general, not specifically the way we define it, part of your life or daily practice? We're having some, okay, we have people that are extremely familiar with the concept so far. And exactly, so the second part, we will share also the results after, but the second part of this little poll is divided into 4 possible answers, no? So is it part of your daily life? The usual yes or no? Not really, or I would love to, which is something that we would really like to investigate more. At the end, the scope, one of the scopes of this webinar is to understand how we can move forward and how can we make green care a reality or more mainstream across Europe in this case. We have 32 out of 40 that participated. You're still on time. We will give you a few seconds more, and then we will share these results also. It was 32 also before? It was 34 maybe?
34, yeah.
Arte in Orto, we focus on there. Oh, okay. Hello, Caroline. Or Caroline. I don't know. Thank you for sharing. Okay, then we can share the results. Exactly. So does anybody who is not would say that is not familiar with the concept of green care, is any of you willing to share how did you end up on this webinar? If you're curious about what we're doing, is it something that you're just starting to discover? Okay, we have Catherine, based in Scotland, dealing with projects enhancing biodiversity of care, home, sheltered housing, gardens, as well as school grounds, businesses, etc. With, strong focus on mental health and well-being. Thank you for sharing, Catherine. Okay. Still too soon to say why not. It's okay. We can. Is there anybody who wants to share has a comment about these specific questions? When you say, for example, that you would love to have green care being part of your daily practices? Is it because it's not a reality right now? It's because you're facing skepticism, or you can share now or during the course of the webinar. There's no rush. This is an open discussion, so no worries. Okay. Yes, we can move forward, and we would like to give the floor to our main stars, to our main guests, Renata and Beata. We will share your presentation now. They will walk you through their amazing work and how important their work on Work Package 2 has been as the basis and foundation for all the work that we're still doing in GRIMI. Please feel free to tell us next every time we have to move slide. Don't worry. Okay, the floor is yours.
Thank you, Antonella, for the excellent introduction. We would like to say a few words about our work, but believe me, it's not so easy to do it in a couple of minutes to present the work of 1 year of so many people. So, but we will do our best. Next, please. Next slide, please. Because not all of you are familiar, we expected it that it will be like this. And we must say that there is a specific way of defining green care, because we have different definitions in the literature, different projects which are focusing. And our project recognize green care as a broad spectrum of activities of exposure of people to nature, from nature in everyday life, which is providing the opportunities to contact with the nature, and these are activities planned by local governments. So local governments are responsible to give us the opportunity to contact with the nature by planning green spaces. Nature-based health promotion, it is related to organized activities to support people to engage with the nature. And the nature-based therapies is the therapeutic intervention. So these are the 3 levels which form the framework of green care in the GreenMe project. Next slide, please. As Antonella already mentioned, our work package is the first diagnose phase of the project, and it serves as a set of information to feed the rest of work packages. So our main objectives was to understand the status of green care implementation, as well as identifying the main opportunities and barriers associated with integrating the 3 scales of green care to achieve equitable mental health benefits. And it's also very important that we are focusing on marginalized groups and also only for adult people. So we are not focusing on other users of green care. So maybe it will be not a complete picture of the green care, but focus only on mental health and only on mental health of adult peoples. And as Antonella already mentioned, we also try to identify the best practices. So what really works at our country areas. Next slide, please. We have 7 mega study areas in Sweden, UK, Spain, Italy, Germany, Poland, and the US. They differ in terms of the level of urbanization, land cover, and the distribution of natural areas, but I think that they are very interesting cases, because in some of these areas the green care is already developed, and we call them frontrunner countries in our project, and follower countries like Germany, Poland, and US, and we are also some green care activities, but they are not so well organized, and I think that we can learn a lot from our partners from other countries. Next slide, please. What were the key actions in the framework of our work package? First of all, we start with the mapping of stakeholders, because we would like to know who takes care of green care, who are the stakeholders, and this was a very important part, because we would like to find the most important stakeholders to form the national groups of experts, which help us in the next phases of the project to form the national policies to implement green care. The two next phases were related to identification, the stage of implementation of green care in our country, partner countries, and we have done it using two methods. First one was the gray literature analysis, and the second, the interviews, where we would like to know the perspectives, stakeholders' perspectives on green care implementation. And based on these two phases, we identified the 13 successful models for providing green care. Next slide, please. Stakeholder mapping, as I mentioned, it was the first phase. It was based on our primary knowledge, so our collaboration with existing green care providers, as well as literature, research reports, policy briefs, strategies, and all sectoral policies, blogs, websites, etc. And we identified more than 600 stakeholders, and then we characterize them, taking into consideration different variables. We were interested in sectors that green actors belongs to, levels at which they operate, the role they play, if they are policy and decision makers, implementers, or supporters. We were also interested in the particular focus on the one of the green care dimensions. So if they deal with nature in everyday life, or nature-based health promotion, or nature-based therapies. And then what are their end users? And we were also interested in the power of the green care actors. So we also analyzed the level of expertise and influence in the matrix to know who, to identify the key green care actors, to invite them to be a part of our national group of experts. Next slide, please. The report on the green care actors is a very big, very huge report, and I have not enough time to present all the results, but only 2 slides showing the brief characteristics of green care actors. As you can see, there are a lot of fields of activity, not only the health or social care, but also agriculture, climate change, consulting, education and training, nature conservation, spatial planning, finance, sport, recreation, and tourism. But when we look on these results, the two first sector are the most important. But when we look at the specific countries, for instance, in one of our study areas in Kent, England, the education and training is the most important sector. When we look at the target groups, most of the activities are focused on general population and patients, and only a few of them are for the marginalized groups. And it is also the proof that we need to give some guidelines and to focus attention that it is a very important problem of inequity in mental health for the specific groups. Next slide, please. We were also interested in the other variables, as I mentioned, and you can see the sectors, and the vast majority of the green care actors belongs to non-profit sector, and they operate at the local level. And most of our green care actors are implementers or supporters, and only few of them policy and decision maker, which indicates that it's not embedded in the policies, the green care issues, and it is not already implemented in healthcare system. And if we look at the green care focus, you can see that it's a balance between all of these dimensions of green care, of course, but it varies in particular country. Next slide, please. The next phase was the green care implementation, how it is written in the gray literature. What we are specifically interested in all the definitions, classification, characteristics of the three dimensions of green care, about the provision, accessibility and quality standards, different dissemination tools, competence and quality assurance, management, financing and development tools, as well as data sources. Next slide, please. We have conducted this research in the separately for the three dimensions of green care. And for nature-based nature in everyday life, we first of all try to find the tools which support green and blue spaces development in partner countries. So most of them were related to the specific tools dedicated to green and blue spaces development, so some local policies, but they were also embedded in the framework of spatial planning or nature conservation. Next slide, please. We were also interested in the standards, because it is also very important to have a standard, because it is a guarantee to the equal accessibility for and provision for green spaces. So we have provision standards, accessibility standards, and quality standards. And the quality standards are really very rare because we are focusing on the, for instance, square meter per capita or green space ratio or the distance to green spaces, but we pay less attention in these standards in the quality of the environment and the land cover features and equipment quality or the reception capacity of this area. So it was also very interesting for us to see the quality standards. Next slide, please. In the second dimension of the green care, so nature-based health promotion, we try to identify different health promotion activities. So these organized activities focused on engagement people with contact with the nature. And as we can see, the social agriculture and horticulture is the most important, and other activities in the outdoor environment, like environmental education, green exercise, well-being walks, farmers hosting tours, or environmental conservation, as well as citizen science. Next slide, please. And how people can learn from these promotional activities. We also try to identify the promotion tools because they are very, very important. And portals and websites here are the most important, some information campaigns, environmental education programs and projects. But there are also interesting solutions, for instance, in the UK, green prescribing programs or outdoor recreation plans and programs which help people to engage with the nature. Next slide, please. In the third dimension of green care, so related to the nature-based therapies, we try to identify the nature-based therapies which are already applied in our country areas. So the most common is the horticulture therapy and forest therapy, but we have also animal-assisted therapies, adventure therapies, blue therapies, ecotherapy, and care farming. So this is the broad variety of different activities related to nature-based therapies. Next slide, please. What was also interesting to learn about the quality assurance tools. So how we can assure that the therapies will be provided in the same way. So are there any certifications, accreditations, codes of good practices, or is there any training for professions and how they are embedded in universities, or only there are some only trainings? And we are also interested in some standards. If there are standards for the nature-based therapies provision or accessibility, or the standards for the environment where the therapies will be realized. Next slide, please. And we, in this phase, the last element was to identify the financing schemes for green care, because it will be also very important to share the ideas among partner countries how it could work. because in the last phase of our project, we will prepare the guidelines for the green care implementation, and the success of implementation is also to find the sources of financing green care, or some schemes how to do it. Because most of these activities are grassroots activities, they are mostly based on some grants, donations, but some of them are embedded in activities of local self-government, so they are paid from self-governmental budgets. Some of them also have the profit from the main business, so they combine the nature-based therapies with other services like horticulture, for instance. But some of them are some of them, for instance, in follower countries, based on the civic budget, so the part of budget which the community allocate for citizens projects. Next slide, please. Now I would like to give floor to Beata, because she was a leader of the social research.
Okay, thank you, Renata. So, very short report of our stakeholder perspectives research. We provided more than 100 semi-structured interviews with our stakeholders, distilled previously from the list Renata has shown you, and we coded it of course according our research questions, but the main levels of groups of coders concerned status of green care implementation, promotion, equity issues, to map marginalized groups of our receivers, and then conflict and barriers in green care development in our consortium countries. Next slide, please. So, what can I say about green care implementation? I think the most important is that we agreed between our teams of stakeholders that green care is still not well embedded in public system and needs formal recognitions. Then also about trainings, many practitioners operate without sufficient training they need. Cooperation between health, social care, and environmental sectors still remains inconsistent, and access to good quality green spaces is varies between among communities. And of course, funding, money, and one more time money, the unstable fundings, and even everyday nature contacts is quite well developed, but clinically oriented medicinal programs remain scarce. Next slide, please. About promotion tools and activities. Promotion also seems to be fragmented and lacking of coordinated strategy. And we have, of course, existing promotional tools, but they are underused and just are not widely recognized, lacking of organized outreach. And also communication does not sufficiently reach our receivers groups, and mainly led by NGO rather than public health or government bodies. It looks like clear pathways for health sector led promotion of green care are largely absent. Staff also involved in promotion often lacks appropriate training and even communication skills. Next slide, if you pleased. Accessibility. Access to green, health, and green and blue spaces is uneven and strongly influenced by where people live and what they can afford. Time pressures, poverty and demanding life circumstances even reduce opportunities for many to be engaged with nature. Also, some groups of our receivers, our respondents, do not feel that green space are welcoming or meant of them. So maybe this issue of greenwashing, we have to take more concern on it. So greenwashing, green gentrification, safety concerns, and poorly maintained environments discourage use of natural areas. And of course, we have different socioeconomic status, migration background, and education levels, and it shapes people's ability to benefit from nature as well as physical accessibility to greens. And next and last slide about interviews level stage research. So hello, public awareness of green care. So it is main barrier. Still, biomedical, drug approach continue to be dominate. Institutions have no staff, training and organizational capacity, bureaucratic hurdles and unclear regulations restrict the delivery of green care activities. Green spaces compete with housing and commercial development with money, as always, reducing the available land. More about money, so funding is insufficient, or if it is unstable and does not support long-term programs. And also people complained about transport and mobility barriers. It still limits people's ability to access nature-based initiatives. Next slide, and I give floor back to Renata.
Thank you very much. The last phase was to identify the successful financial and organizational models for providing green care. And here I would like also to give some explanation, because how to measure the success, it's not very easy. And within the framework of our research, we decided that the successful models for providing green care will be understood as the way to effectively provide one of the 3 levels of green care, with a focus on health equity, benefiting the health of those who need it. And that this successful model can be used as a kind of a benchmark, or can be applied to similar conditions elsewhere, and can be thus referred as a good practice. The term covers all activities related to providing nature-based therapies and nature-based health promotion, as well as assuring the nature in everyday life. And it is a kind of umbrella. The best practice is the umbrella term. What was the criteria to select the case studies? First of all, it was a sustainability of the intervention. It was a project, solution, initiative, approach, program, etc. What does that mean, that the sustainability of the initiative? It has the financial, material, and personal and other resources to support its operation, so durability of the project. And the second important criterion was the reference to mental health. We have identified 13 successful models from all the countries. We prepared a kind of catalog of these models, and we characterize them in the similar way, so describing the implementer, the sector, the field of activities, the green care focus, but we were also interested in core objectives, in organizational structure, and success factors, as well as key messages from these interventions, and the scale. So I would like to show you only one example, because it is not possible, but Antonella, as I mentioned, sent you the link to the catalog, so you will find more examples. So next slide, please. One of our best models is the social cooperative social farm from Bologna metropolitan area. It is a non-profit sector which combine half social care with environmental protection and nature conservation. It is focused on nature-based therapies and promotions, but also its activities are related to horticultural production. So it combines and promotes biodiversity and sustainable practices through therapeutic horticulture and community engagement. It has the dual structure with agricultural production and rehabilitative services for people with mental health. Next slide, please. What is important that this NGO organization collaborate with public health services and other local cooperatives. It has over the 50 active therapeutic pathways, and the model demonstrate long-term sustainability. So it is very important that we can learn a lot from it, and I look forward to our next meeting in Bologna, because we will have the opportunity to visit this wonderful initiative. Next slide, please. I would like to show you the successful models by sectors, because it is also very interesting, but most commonly these initiatives intersect with nature conservation, environmental protection, as well as spatial planning, these which are related to health and social care. And it is worth to mention that this interdisciplinary approach reflects the holistic nature of green care, which seeks to harness the benefits of nature for mental health and well-being in multiple dimensions. Next slide, please. Some numbers. We have already mentioned 12 months, 8 mega study areas, more than 600 stakeholders identified, 9 green care actors completed, almost 600 items of gray literature, as Beata mentioned, more than 100 semi-structured interviews, and 13 successful financial and organization models for providing green care. Thank you very much for your attention.
Thank you so much, Renata and Beata. It doesn't matter how many times we discuss this, I always find out something new. So it's always a pleasure to listen to you, and you sparkled quite some interest in the chat. The chat has been super active. We've had people agreeing with the barriers that this type of initiative encounter. We've had people suggesting start networking because they want to hear out more from each other. This is great. What we would like to do now is try to see which insights have resonated more or the most with our target, with our audience. Here we have a poll we can launch. We've discussed multiple things, so we understand that it can be quite hard to summarize, but it would be good to see if there is something that really mattered to you. Some of you shared it in the chat already, but please feel free to draft a small paragraph, and we can see how to move forward with this. What do we have here? Well, let's say we take a couple of minutes for this exercise without me talking, so you can concentrate. couple of minutes more, and then we share the answers. Okay, so far we have 14 replies. We can wait until half past, and then we share the results. All right. Sorry for those who were mid-typing. We're gonna cut you off now, but you can share in the chat, it's fine. So what do we have? Let's see. I don't know, how can we, no, it's here. Yeah. Okay. Okay, can you share your screen? So we try to share the screen and see all together. Exactly. So we have a few words that appeared multiple times. So health, projects, funding, understanding. We have a few answers. Let's see. So a major reason why so many programs struggle is dependence on grant funding, which is great when you get it, but there never seems enough to go around. Yes, we're all like, yes. I have experienced this over and over, and I appreciate how you have articulated this. Thank you. That's very, very, very good insight. We have training, how to train mental health professionals with foresters. Several aspects. Wow. Okay. So the complexity encounters from countries, green spaces, practitioners. We cannot generalize. That's true. There are things that are easiest to measure. The funding, okay, funding, it's a problem. I have the feeling that funding is a problem for if it's a problem for everything nowadays. Everybody's struggling with that, unfortunately, especially the good causes. Transformation, everything. That's great. Particularly green care, and that green care increases health and well-being, but is extremely difficult to fund sustainably. Yes, absolutely. We try to evaluate nature-based promotion activities, but we have more quantitative data than qualitative. Yes, and this might be a challenge. It's the fact that the majority of intervention are carried out by NGOs. True. Also, hi Marta, you're a new member of the project. Welcome. It's nice to see you here. Indeed, we have. Okay, then we have Catherine. She has a question. Hi, Catherine. And I think maybe Renata, you can, or Beata, you can address this way better than me. So if you want to take it, it's about comparing frontrunners and followers in relation to their green care activities. It looks like they have the same amount of activities, but is it just the followers, they don't label them as green care, or is it less structured? Renata, if you want to take this.
Yes, in some aspects, the differences are blurred between the frontrunner and follower countries, but the main difference is that the green care, especially the nature-based therapies in frontrunner countries, are linked to healthcare system. So it's a program of green prescribing, which is absent in, for instance, in Poland and in Germany. There are some initiatives to combine it, for instance, in Poland, but in social care. And in Warsaw, we have very nice initiatives. So for all, in all social care homes for elderly people, there are developed in last 2 years the sensory gardens, and the hortitherapy is the standard social care, which is standardized, and staff of these houses is trained to conduct hortitherapy as a part of everyday life of elderly people living there. So there are some initiatives, but this is a question of the system and of the scale, and it's not really implemented.
If I can say something more, I cannot see any differences between frontrunners and followers in our respondents' answers. So I'm sure that next step, if we have next project, next financial opportunities should be leading quantitative research based on the result of interviews, because I'm sure the issue is in numbers, but problems are stayed the same. Thanks.
Thank you. Thank you for covering this I hope it answers your doubts, Catherine. We have some more answers here. Yes, Zala, they are pointing out that the idea of a green care system is not really integrated. It's not very mainstream. It's not very popular, and it's probably unknown to the general public. And this is something that we're trying to solve with our work within Work Package 6 in the comms and dissemination unit of the project. We must say that it's great to see how many people we have been we could engage so far already, and seeing your interest, this is very good for us. So please keep following us and keep showing up to these webinars. There is also maybe understand more about how different projects can work and why. And get an idea of different projects in different countries, get tips from others over the chat. That would be great. This is also the idea of these webinars. We would like to foster a sort of exchange and community building that goes beyond these 90 minutes. There will be, at the end of this session, we will have a little poll as part of the GREEMY project. We are creating what we call the European Green Care Network. Maybe some of you has already expressed interest in being part of it. The idea is to create the army for the Green Care GREEMY project legacy when our project ends, formally ends, let's say. And we will build a sort of platform. It might be a LinkedIn group, most probably, where you will always be invited to exchange and discuss. And I believe that probably we can launch that poll and see who is interested in joining us.
Wait a second.
Yes, of course. Mm-hmm. Give us a second. In the meantime, I don't know if we have probably some. Yes, Catherine replied, yes.
Just a few sec.
Yes, of course. Okay. Why is it like this? Whether we're building it should say European Green Care Network. I don't know why there are the dots. It's not a secret name or a secret agency whatsoever, but that's what we're building. So if you would like to be part of it, we can already take your email address from the registration spreadsheet that we have, if you agree with this, and put you in our database. Right now it's just a spreadsheet, and then once we give life to this platform, you will be invited to join us. How many? Okay. Thank you. Basically, everybody wants to be part of it. I appreciate it. We appreciate it. We're cool people. Thank you. That's great. We will give you a minute to submit your answer. And in the meantime, if you haven't if you haven't subscribed yet, we would like you to invite you to subscribe to our newsletter. The link is in the chat. To listen to our podcast, Naturally or Naturally. It depends on which sound you like more. And we already shared the link of the interview we had with Renata, but we have chatted with all our work package leaders and with our young researchers. There is some good material there. If you're interested in knowing more, it's not just project related, it's about this environment in general. So don't miss it. And yes, we have almost everybody that said yes. So one more minute. In the meantime, I will give Pilar, yes. So in Catalonia, you have table of nature and health, especially for children and teenagers. Oh, that's very good. Thank you, Lena. And yes, this is out of the scope for the project because we focus on adult mental health, but it was indeed one of the things we discussed during our previous webinar, how important it is to introduce green care, not only for adult mental well-being, but also for children and teenagers. That's very good insight to share. Thank you so much, Pilar. I think we have basically everybody. We can exit the poll. In any case, if you didn't submit your answer and you think about it and you want to be part of this, feel free to drop us an email. It's also fine. I would like to thank you all. I don't know if Renata or Beata, you want to share a final some final sentences, or
I want to just say thank you very much. Thanks for being so crowded in our webinar with us, and it was great pleasure to share our findings with you.
thank you.
I also would like to thank you very much for being here, for giving us opportunity to share our experiences, and I hope that all these links with the more detailed informations will give you some more insights into our works. Thank you very much.
Thank you all. You will find the recordings on our website, and see you next time. Thank you. Bye.